So I really want to talk about this antimicrobial resistance, especially let's take Salmonella typhi, the bacteria that cause typhoid fever, popularly typhoid. I've been in a lab for many years and I've done a lot of, typhoid tests. You can do tests for someone, the person will be on medication. After the medication, the person will come back, the typhoid is still there. I keep asking my question, why do most people have difficulty in treating typhoid? And there are lots of factors. Okay, let me start from the minor factors. One, most people that use medication to treat typhoid, they go back to what? The source. Example, you said you are treating typhoid, but you are still eating salad outside. You don't prepare your own food. You don't do certain things for, like, you don't wash them well, you don't wash your hand well, or the water that you are using to prepare that particular food is already contaminated. Or after preparing food, the one that you use to wash your bowl is the normal tap water or maybe some boiled water. Okay, imagine using contaminated water to clean your what? The dishes that you are going to fetch the food in. You see, those are the common mistakes that you make. That is why people keep treating one particular infection over and over. You thought you are protecting yourself, but there are some minor mistakes that you make to what? To keep the bacteria active in your system. So that is one factor why people keep treating typhoid over and over. Another one is someone can just stand up and take antibiotics anyhow. You just assume that you have urinary tract infection. You do not even go and test whatever is causing it. We have a lot of bacteria that can cause UTI. We have E. coli. A lot of them are there. So if you want to treat something like urinary tract infection, please kindly make sure you go to the lab, let them do the test, and it must show that this is what is causing it, and there will be a specific antibiotic for that particular urinary tract infection or the bacteria that is causing it. But nowadays, the pharmacy is open. Somebody can just walk in and say, please, I want to get this antibiotic, I want to get this. That is the main reason why Salmonella typhi is what? Resisting most of the antibiotic nowadays. That is the main reason. People are abusing antibiotics. They don't even go for the test. They can just stand up and take it. As I'm talking to you now, someone is even taking antibiotics without even knowing what he or she is treating. Okay. The last one that I want to talk about is the bacteria itself is trying to produce, or it have already produced, a different strain that is resisting most of the antibiotics that are out there. Even the new one that they are developing to fight against the bacteria, they are resisting it. So you have to be careful not to let anything like Salmonella typhi to get into your system. Not that you use a lot of years, effort, money in treating it. Kindly be careful. Employ the high level of hygiene, like wash your hand, especially when you go to the washroom. Wash your hand properly. The food vendors, we beg, whether we are buying food outside, you are our last hope. Kindly take care of our food for us. You know, you don't have time to prepare food. You go to work before you close, it's already late. You need to get some food in. So please, the food vendors, we are begging you guys, kindly take good care of our food. Wash your hand very well. Anything that you guys are using to prepare the food for us to buy, make sure they are clean. And for those who like buying food outside, especially salad, please kindly be careful. Right? How long will you be buying food outside? Try your possible best and prepare your own food in the house.